Alright, so I decided to do my project on trauma stress disorders and treatments. So, post traumatic stress disorder, PTSD, and substance use disorder, SUD, were both highly present in Iraq war veterans. The presence of both of these led to poor psychological functions, poor physical health, increased risk of suicide, and negative treatment outcomes. Along with that, these war veterans were mainly involved in the OEF, OIF, and OND operations. Of the returning veterans, 49,000 of them were diagnosed, and only 9.5% of them attended sessions within the first 15 weeks. However, if they had attended sooner, there would have been more positive results from the treatments. So, examiners developed a new method to address these symptoms. They called it Integrated Cognitive Behavioral Therapy, ICBT, which is an intervention that showed highly positive results among civilians. So it uses tests to determine the levels of severity, and then use these tests to track the levels throughout the therapy program. The program was then later modified to better accommodate war veterans, as it would have been more helpful for them to relate through their war stories. With their convincing information and this 15-week program, scientists hypothesized that implementing the program would be done with ease and effective results. The expectations were that the efficacy and the program will convince more veterans to partake and have their symptoms decrease by a major number. Uh, with this therapy program, examiners expected to see a good number of participants, uh, having only taken in participants that were referred by doctors. They later expanded it to anybody that was in a VA medical center, and they did that by posting flyers throughout the hospital. No, not only that, they maintained their participants with these three skills they designed to help improve their symptoms. So they would educate these participants of the PTSD and SED treatments. Along with that, they would have sessions of mindful relaxation, and they would learn the concepts of flexible thinking. So to effectively record the data, examiners set criteria that had to be met in order to participate uh, in the study. So individuals had to have been diagnosed within the past year and had to have been involved in a program and completed at least 8 sessions. They also had to have been a part of the OEF, OIF, or OND operations. With the criteria set, only 35 veterans qualified, 15 agreed to participate, and only 12 made it past the first assessment. Uh, and of those 12, 6 received sufficient treatment and 6 did not. And those that did not receive sufficient treatment ended up dropping out, so there was an inconsistent number of participants. Of these participants, the average age was 38, and they were all Caucasian. The CAP scores, which was used to determine their symptoms, was 88.17, which was high levels of severity. So, with the research going on, not enough participants were present to reach a conclusion. The theory proposed by the examiners was as confirmed, as they did not have a big enough sample size as they expected. Um, the average flow was 3 to 4 participants per month over a 9-month span, which wasn't enough. Uh, it was not as easy to encourage veterans to receive this new therapy, and not only that, since they were all Caucasian, they did not fully represent an ethnically diverse group. No distinction was made between the two groups which received sufficient and insufficient treatment because they had mixed results and there were outlying factors that influenced it. For example, participants were allowed to continue any outside treatment that they were already a part of, so that could have affected the outcome. And they were not in a controlled environment, so their daily lives, such as work and school, could have influenced their decisions. And on top of that, it made it harder for them to schedule appointments. So with the Quine-Duhem thesis, auxiliary hypotheses had to have been met to confirm the main thesis. So one of them was that the symptoms had to be present as a result of the war. And that could be possible, but some of them could have had these pre-existing conditions prior to the war, and just have some of them lingering on, which could have made it more difficult to assess uh, the problems that they were having and a way to better manage it. Along with that, individuals had to retain the ability to succeed in both an individual and group setting, and that was very important because the program had both present, but many of them didn't make it past the first one, which was individual assessment, which meant that they lacked the ability to succeed in both environments. Not only that, there was an underdetermination of the study where it was approximately 49,000 veterans that were diagnosed. 9.5% of them received treatment, which meant that it was approximately 4,700 that actually received treatment. And the sample size that was used to test this new therapy was less than 1%. So it was way below than what was needed to actually reach a conclusion. And also, it will never be sufficient enough because just the sample that actually already go to therapy is too small to actually influence what would happen with the remaining 40,000. So even then, when the study is divided into two separate groups, results obtained of the two were also inconclusive, as there was no significant difference between the two. So regardless of what they had done, a final verdict couldn't be reached due to lack of participants.